Don't make the mistake of doing the wrong exercises for your low back pain. So we have a lot of clients that scour the internet looking for more information on how to make their back stronger and get rid of the pain, but then they end up doing the wrong stuff and it really slows them down in their rehab process. And they keep getting into this wheel, this hamster wheel of having back pain and getting down where they can't get up for a week straight. If that sounds like you, then this video is going to be perfect for you, breaking down exactly what we shouldn't be doing first. We're going to look at the anatomy of the spine. So we have to think about going into flexion and extension in our lumbar spine. So when we go into extension, if you can see this right here, we have all this space for our nerves. When we go into extension, we close down that space for the nerves. When we go into flexion, we put a lot of pressure on the discs. And if we have a disc that is protruding at all, then when we go into flexion, we're pushing out in that area. Now, most of the back problems that we see are hypermobilities. We move too much in one area. So what we want to do is train in neutral, and that's why these exercises are really bad for your back pain and it's causing it to continue to come back consistently. That can be a really irritating process. So let's dive right into some of these exercises. The first exercise is the Cobra. So the Cobra is coming up. It's like a McKenzie technique where we're pushing ourselves into extension. They want to restore movement. But what we see is it really irritates a lot of people. So if you're one of those people and it doesn't feel good for you, then let's try to avoid it. So I'm going to show it to you right now. It's laying down right here. I am one of those people, so I'm doing this for you. So I'm pushing up and really stretching my abdomen and pushing my back into extension. And so a lot of people will push way up into this position. What we've found here at the clinic is that it causes pain for a lot of our clients. So we try to avoid it and we want to stay in neutral. Number 2 is hamstring stretches. So a lot of people will do hamstring stretches because somebody told them along the way that their hamstrings were tight and that's what's causing their back pain. What I can tell you from doing this after 13 years is that it's not just one thing. So just chasing hamstring stretches all the time is not going to work. But one of the biggest problems with hamstring stretches is no matter how I'm doing it, if I'm doing hamstring stretches, I'm folding through my low back consistently. So I'm pulling on my low back and I'm stretching my low back while I'm stretching my hamstrings. And if that low back muscle and the low back tissues are irritated, then that's going to cause more irritation if I continue to pull on it over and over. I want to give it a little bit of a rest. I don't want to be pulling on that tissue. I want to allow that inflammation to be taken back in. Before we get into the other exercises, I wanted to ask you to subscribe to the channel. I want to make sure that you don't miss out on any of this information. We're going through things that we want to avoid. We don't want to be doing this stuff because it's going to cause us to have more back pain. We don't want you to miss out on the stuff to do because there are positive things that we should be doing for our back, and we're going to make sure that we're posting really quality content so that you can figure out how to fix your back pain. Number 3 is my most hated exercise. It's a stretch, it's a crossbody stretch, and we are not, I've heard it several times that this is a hip mobility. I'm working on my hip mobility. They wouldn't be in my office if they were working on hip mobility. They're working on low back mobility. So the way that they do it and the way that I see it fairly often is that they're laid back and they come over all the way right here. Now, I am getting my hips to move around. I'm getting a little bit of mobility, but most of the time they're twisting up so much that they're moving through their low back. And as we talked about earlier, if we move too much through our low back, then we're just going to be irritating those tissues. We want to take the stress off the tissues. So doing that crossbody stretch doesn't seem to be helpful for our clients. Number 4 is a Superman. So a lot of our clients, they come in, when they initially come in, they're saying they want to get their back muscles stronger to protect their back. Well, if the tissue's getting irritated and then we push it into an irritating position like a Superman, then we're going to be feeding those low back muscles. We want to feed our glutes. We want to feed our thoracic spine. We want to be moving through areas. We want our Superman, Superwoman emblem to stay stacked when we're moving around. What happens is we get weak in the glutes. We start using our back extensors all the time. So the Superman is one where we actually end up primarily getting our low back muscles to be the strongest muscles. So they'll hold it this way and come up as high as they can. That's going to end up causing us problems. I actually had a client that came in probably 2 years ago, and he had a friend that told him if he can do a Superman for 3 minutes, then he wouldn't have back pain. That didn't work. But then we had so much trouble getting him out of back extension and actually getting him to use his glutes and stay in neutral because he had fed it for so long. So that's a big one to avoid. Number 5 is crunches. Crunches are a great exercise for your abdomen. We can get a six-pack. We can start looking really good, but it's not great for your back. So crunches are better than sit-ups. So let's be very clear that sit-ups would be much worse than crunches, because sit-ups, when we're doing a sit-up, this isn't on the list, so this is bonus. So sit-ups, when I'm coming up, which I'm gonna shake a lot, when I'm coming up, I'm actually doing hip flexion. I'm doing much more hip flexion than I am doing abdominal work. And we wanna do abdominal work, but I don't need to be tilting through my abdomen over and over and over, right? Because then I'm just getting that crimping over and over in my abdomen. So when I do crunches, I want to do more resisted motion for my back. So resisting extension, resisting rotation. I don't want to be doing things that are making me twist up over and over and over. If you think about your spine, it's a biological paperclip. So we have the ability to heal, but if I'm twisting up over and over and over, paper clips, they just break. So in the spine, we're getting that irritation, and we're going to start getting that breaking as well. Number 6 is another abdominal exercise. So we're working on leg lifts. So leg lifts, the issue is that our back goes into extension, and so we're just tweaking right there. So when I lay down doing leg lifts and coming up, my back is going up into extension. I don't want to do that. I don't want to be moving through my low back. I'm not trying to work my low back muscles. I'm just trying to work my abdomen. Another variation of that I've seen, where I've had a client tell me, hey, I've been doing this for 6 months. It just doesn't seem to be working. We cut it from the program, is leg lifts going from side to side. So he was coming up right here and then going all the way to the side and coming back up. So he's doing the same thing. He's using his low back muscles a heck of a lot more than he's using his ab muscles. We want to resist motion there. We're not trying to fire up through our low back muscles at all. So if we're doing any exercise like that, we want to flatten out our low back. You can roll up a towel, put it underneath your back, maintain the normal curve, but then we're working our abs through smaller ranges of motion. We don't want to have those big, long ranges of motion that start causing irritation in the low back. Number 7 is planks. So we hear all the time that people are doing planks. I got to do planks for my low back. Now, when I had my own back injury, which if you watched our first video, refer back to our first video on the channel where we were talking about my back injury, where I have had an issue for over a year where my back was bothering me. And I had somebody tell me that was helping me, tell me that if I could do a plank for 3 minutes, then I wouldn't have back pain. So similar to my other client's story, I got up to 5 minutes, but my back still hurt me. One of the reasons for that is the position that my spine was getting in while I was doing a plank. So I want to tuck a little bit more into flexion if I'm doing planks. I don't want to go into back extension and cause that irritation in my low back. And if you're not able to maintain a good position with a plank, it's really important to just go down to your knees. With all of these exercises to help our low back, we want to be successful with them. We want to work out in successful positions. So if I'm coming up into my plank, I am going to tuck my abdomen a little bit more and maintain this position. I'm definitely not going to drop down right here, because now I'm in extension and this is going to cause irritation in my low back. If you go into a plank, this is what happens with a lot of our clients. When they go into a plank, they feel the nerve getting irritated down their leg. That's a clear indication that it's not helping you, it's hurting you. That inflammation, that's your body sending a signal that you're getting inflammation on that nerve, and we want to take it out immediately. To summarize this video, we have a lot of movements that are going through the low back, and that's the theme, that we're moving through the low back. We're doing exercises and stretches that are moving too much through the low back when it's an area that's causing us problems and it's causing us irritation. So I want to ask you guys to make a comment and let us know if you have any questions. If something that I didn't go over is in your repertoire, in your routine, and you need more information on it, please leave a comment and let us know, and then we can get to a video where we can address that for you. Like, subscribe, hit the bell icon so that you get a notification when we come out with new videos. You're going to be learning a lot of stuff on this channel, the exact things that we do to help our clients. So I don't want you to miss out on any of that information. So we'll see you in the next video. Get mobile and stay active.